Hey folks, so some of you know that I recently had PRK Laser Eye surgery. I'm about 9 days out from my procedure, and so I wanted to give you a little bit of an update. So on the day of my procedure, I was taking antibiotics and oral steroids, just in advance getting them in my system to help me heal from the procedure. So I went into the procedure, they kind of reran some tests. That took a little while just to kind of double check everything on my eyes, make sure everything is where it was when they did the initial tests. So I did that, and then I went into another room to get ready for the actual laser surgery. They put some numbing drops in my eyes. After my eyes were good and numb, they used basically a marker to make a little mark in my eyes. I don't know exactly what that is. I'm sure it was some sort of alignment thing. Now, on all this, I don't know the medical terminology. I'm just describing my own experience. So after my eyes were numb, which was kind of a weird feeling because you can feel your eyelids, you can feel the skin around your eyes, you just can't feel your actual eyeballs. After they were numb, they went ahead and brought me into the laser room. Walking into the laser room was a bit of an interesting experience. It feels more like you're in the Death Star or a space station than in an actual medical office. There's all kinds of lights and lasers and glowing screens and big equipment. So walk in, they darken the room, they had you lay back on a table, and I look up and I see a whole bunch of lights and then one little red dot. And the doctor tells me that all the lights are basically for them to be able to look at what's going on. They've got some cameras in there, lights that are, it's basically like a targeting laser for aligning your eye, but the one red dot that you're looking at is just to give you something to focus on, just to look at the same point. So I was having PRK, not LASIK, so they didn't have to cut the flap. But what they do in PRK is when you're looking at the laser, they bring something close to your eye that kind of looks like an electric toothbrush, and they use that to buff off the surface of your eye. After they take that outer layer off, then they bring in the laser equipment and they use that to do the actual sculpting, to actually do the cutting and shaping of your eye. And with the laser going off, again, they keep you focused on this red dot, and you kind of see all these blue flashes. I believe it's a UV laser, but you kind of see a purpley blue fringe around your eye, but your eye's clamped open the whole time. But you can't focus on anything, you just see these flashes happening. The sound was a lot like a taser going off, that clack, 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 if you've ever heard that before. There was a little bit of a smell too. When I was doing some research, people described the smell as being really bad, almost like a burning hair smell, which is the laser sculpting your eye. I noticed it, but it wasn't particularly bad. But it was noticeable. So this whole time they're working on one eye, and the other eye it basically has a piece of gauze over it. It's just closed up. So they do that one eye, they flush it out with some cool drops. I just remember it feeling very cold. I didn't feel any pain or pressure, it just felt cold when they put those drops on there. And then they put a really big contact that serves as pretty much a bandage over your eye, because the surface is still really rough, so that just helps cover up that surface and protect it. So then they put the gauze over on my other eye and did the other eye in the exact same way. So immediately after the procedure, they bring the lights up slowly, and I was able to sit up, and I was actually able to look around. I thought I was going to be not quite blackout blind, but I thought it was going to be really hard for me to see anything. Everything looked really hazy. It looked like I was in a sauna or something, but I could actually see just fine to stand up and move around. I walked out of that room, walked into the next room. The doctor basically looked through a scope at my eyes, looked at the procedure. Everything looks like it came out as it should. They gave me some more drops to put in my eyes and gave me some goggles to put on. And wearing those goggles, I was able to walk out, and my buddy drove me home, which I'm really thankful for, because you're definitely not good to drive right after the procedure. And then I got home, and basically they told me to just relax and take a nap for 4 hours. And right before the procedure, they gave me a Valium, and I think that basically just helps relax you. I didn't really feel any effect at all, and I think kind of my adrenaline was pumping from just this new experience and a little bit of trauma to your eyes. So it was hard for me to kind of sleep and relax and rest, but I pretty much just drew my curtains, pulled the covers over my head, and just sat there for 4 hours with my eyes closed and started listening to an audiobook. And that whole time, so after 4 hours, they tell you to put some drops in your eyes, then do some drops again after dinner, and then before you go to bed that night. I found it very helpful to just use Google Voice on my phone to set an alarm. I would recommend that if you're looking at this procedure as well. So I would take the first drop, and then they tell you put 5 minutes between each set of drops so you don't flush the previous drop out of your eye. So I'd take the first drop, tell my phone to set an alarm for 5 minutes, do the next drop, same thing, next drop, then a couple hours later do the whole process again. Recovery the next day was kind of the same experience. My eyes were still really hazy. I could see enough to move around my apartment, but I was really light sensitive. So I kept all the curtains dark, pretty much kept the lights off or really low, and still wore those goggles most of the next day, and then just kept repeating the drops. I didn't really go out and do anything. I was kind of antsy and pent up, but it's better to just feel a little anxious and stuck at home than to go outside in the bright light and experience either the pain of the bright light or potentially mess something up. I wanted to be really conservative with that. So after that, the doctor said I could pretty much just use the goggles when I was sleeping. So the following days I kept up with the drops. I still kept the lights pretty low because I was still definitely light sensitive, but only used the goggles when I was sleeping. And that's basically just so you don't involuntarily rub your eye and mess something up, or your pillow gets in your eye or something like that. Just a layer of protection that you only need when you're sleeping. In terms of pain, I never really felt any real strong sensation of pain. I would say the most I felt was if you've ever been in a pool that had way too much chlorine, and you open your eyes and you come out and you've got that burning in your eyes, it definitely felt like that at times. And with that contact in my eye, I could feel there was something in my eye. I've had people describe it when they had their procedure done, feeling that like there was sand or grit in your eye. I didn't really feel that, but I'm also used to wearing contacts, so I'm used to kind of having something in my eye. But just that slight burning sensation was kind of the only pain I felt. It wasn't ever bad. It was a little annoying or a little irritating at times, but never debilitating at all. So I kept up with the drops through the next couple days. I had my procedure done on a Thursday, kind of relaxed, and by Monday I was actually good to drive and good to go into work. Now things were still definitely hazy, and it was a little bit weird in that sometimes it felt like my right eye was seeing a lot better, sometimes it felt like my left eye was seeing a lot better. I still had the haze, I still had a lot of what looked like lens flare, or if you've gotten astigmatism, it kind of looks like that starbursty halo effect. I've still got that a little bit, and that's pretty normal from what I've heard, is that's just kind of the light refracting weird in your eyes, and then as your eyes heal, that kind of evens out. So I've still got that, but I was good to work Monday, and then worked through the whole week, and I was functional to drive and walk around and get around. I noticed some difficulty when I was reading a computer screen or just looking at detailed things. On my computer, I would blow up the font as big as it would get, and that helped, but sometimes just kind of the haze would throw me off a little bit, and so I didn't really want to push it. And I've still got some of that. I've still got some of that haze. I wouldn't say I'm light sensitive in terms of pain. I would say when I look at a bright light, sometimes there is a little bit more glare or a little bit more haze, but it doesn't hurt at all. And so what I've heard about PRK is that your eyes heal from the outside in. And so getting that exact focus takes a little bit of time, because that center focal point is actually the very last thing to heal. So right now I would say I'm about in the same place that I was a couple days ago. I can see fine to get around. I can drive during the daytime. I'm not really driving at night just because, again, I've got that kind of starbursty effect. And I'll get there over time, but I'm absolutely functional. And right now I'm just excited that I can see, that I have no lenses in my eyes. I'm not wearing glasses, and I can see enough to function. So, one thing I did leave out, those contacts that I mentioned that they put in my eyes right after the surgery, I kept those in all weekend like I was supposed to, and then 5 days after the procedure I went in for my checkup, and that's when they pulled those out. right after that experience, right after they pulled them out, it was a little bit weird because that contact basically provided a smooth surface for your eye, but my actual eye was still a little bit rough. So when they pulled them out, it kind of felt like there was some dust in my eye, or maybe an eyelash in my eye, something like that. And so it was really tempting to rub my eyes. So that was kind of difficult to not rub my eyes after that. And I also felt like right after they pulled that contact lens out, my vision decreased slightly. And I think that was just because I was used to looking through the smooth surface of the contact lens, and then I went immediately back to the still somewhat rough surface of my eye. And I would say after they removed that contact lens, things have been about the same. Comfort level, it's pretty comfortable. I don't feel any pain in my eyes right now. Just keeping a lot of eye drops in my eyes, keeping my eyes wet and lubricated definitely helps, and that's something they recommend. But I don't feel any pain. It's just kind of that weird haziness, and sometimes I can focus on something really well at a distance, but something right in front of my face is still kind of blurry, or sometimes the opposite. And I think that's just my eyes adjusting and it taking a few days for my vision to stabilize. So through the healing process, I've been told that it kind of takes about a week, which is, I just passed a week, to get to kind of an initial result of where you'll have good sharp focus on things. And I would say I have that at points. And then it can take about a month to completely stabilize. And I would say that's pretty accurate from my experience. There are times where I can look at something and realize when I'm focused on one specific thing, it's in really sharp focus. Or maybe it's really sharp focus with one eye, but when I close the other eye, it's not as good, something like that. But it's just kind of a little bit weird with things being a bit inconsistent. So I'm looking forward to things kind of normalizing a little bit. If you have any comments kind of about my experience with PRK, go ahead and comment below, and hopefully I'll get to them and answer them. But so far it's been a good procedure for me, and I'm really excited about just the possibility of being able to see without, well, I guess I already can. I can see without big glasses on my eyes or without anything in my eyes. So I'm excited about that possibility just getting even better. And if you're interested in my channel, if you want to see kind of adventure videos about hiking, camping, shooting, hunting, stuff like that, please go ahead and subscribe to this channel as well. So until next time.